Thank you, Sahani sir. Good evening, good afternoon, and good morning. This is the 1437th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Thank you all. The International Forum for Promoting Homeopathy has begun its journey some 4 years back, and it's regularly running in a big way. And we have 3 sessions every day. The first session is already over today. That is Hindi session from 7:30 to 8:30. And 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are expanding our Zooms shortly. And we hope all of you enjoy the beauty of homeopathy through these webinars, and you are able to propagate homeopathy among public also by sharing the videos we are uploading every day. The very next day itself, nowadays, we are able to upload the videos, and you can watch again and again and share the same to the public so that more and more people who are not aware of homeopathy can understood what is happening with the homeopathy in this session. So this is what I would like to add in the beginning session itself. So as you all know that homeopathy has a beauty in its presentation. Whatever be the case comes your way, you will have to look into the case in detail and find out the right remedy with the right rubric. When you get the right symptom, then you can choose the right rubric. And when you choose the right rubric, definitely that will end up with some of the best remedies. Then after getting the best remedies, you can choose the right remedy by using different method. You can choose the remedy according with the miasm theory. So sometimes you may have to choose the right remedy by choosing the temperament as the eliminating rubric. So sometimes you may have to choose the remedy with thermals, giving more stress, because whatever be the case that comes in your way, you will have to choose the remedy accordingly. But at times, when a rare, peculiar, common, uncommon symptom is there in a patient, you can go ahead with that alone sometime, and that will be the right person. As we used to say that homeopathy is mathematics. As you all know that why homeopathy is mathematics, we used to say, because you all know that after taking a lot of symptoms, sometimes you may get hundreds of symptoms. But how we differentiate these symptoms with the patient, and we never be able to directly go with the repetition if you have 100 symptoms. So you have to eliminate. How to eliminate these symptoms? That is one of the things that everyone should know and must know, because that is the biggest challenge for a practitioner who come on the way from the very beginning itself. So how to eliminate these symptoms? As you all know that we know we have a group of symptoms in your hand, and on the other side, you have a group of symptoms on the particular disease. So what we do is just eliminate the symptoms of the disease, common to the disease. As you all know that, for example, if you have a fever case, you know that the fever is a body pain, headache, soreness, then very weakness, all these things, and sometimes the patient may be sleepy. All these symptoms are common to the people. That's why when you get a fever, you just start a severe headache followed by vomiting, and then after vomiting, you may went for sleep. And in those conditions, we can eliminate these things from the patient. So the total symptom minus the disease symptom, these are the common symptoms of viral fever or influenza or whatever may be. Sometimes it may be a case of a dengue case, or it may be a case of chikungunya. Whatever be these are some of the common symptoms. That is why we say that we eliminate the total these symptoms from this patient. Then the second, how to eliminate what are the other symptoms. That is, as you know, when a patient there are common, these are the common symptoms of the disease also. But what is the other thing? Because most of these conditions, when people used to lie down, and that is also a common symptom. Most of the patients So you can eliminate that symptoms also, the common symptom to the patients, not particularly a patient. So that can also be eliminated. Then you come, then sometimes you, by eliminating all these two together, you may be able to eliminate 50% of the symptoms from the list of list that you were written in the early part. So then we have another group of symptoms remaining. Then that are, so total symptom minus disease symptom minus disease symptoms common to the patient. Then you get some rare, peculiar, uncommon characteristic symptoms in the patient that you can choose. For example, if the patient is having severe, if the patient is having a severe thirst during fever, but still he vomits, soon after vomiting, she wants to take water again, and that too in large quantity, that too in cold water. So in those conditions, we can think of epitorium, because the patient is having a lot of general. This is a rare peculiar symptom as far as thirst soon after vomiting, and that too large quantity. So in those conditions, this is how we find, even in an acute case, you can find. For example, there is another characteristic symptom of anti-indart, it is very dull, the patient is having very high fever, but still the patient is having very fever-threatening pneumonia. That is the condition. That's and the patient is in a drowsy state. So if you look at the tongue of the patient, you can see the tongue is very important. So in those cases also, we can take this antidote as this symptom. That is the rare peculiar symptom as far as of these particular antidote cases, that very intense heat with extreme tiredness as well as drowsiness. These are the three things, this remedy. So this is how we can reach, even in acute disease, this theory. That's the reason why we say that homeopathy is mathematics. And in conditions, then you get some remedies. If, for example, if you get three remedies after repertorization, how will you eliminate these three, two out to search the right one? Then at that time, you can think of a remedy by choosing this, whether it is the patient is chilly or hot. If the patient is chilly and the two other remedies are hot, then you can go ahead with the chilly remedy. And in other ways, if the three remedies that you get, the patient is chilly, but the remedies too are hot, then you can eliminate the two remedies that are hot. So this is how homeopathy homeopath choose the right remedy, and that works. Then, as you all know, that how then after getting such a remedy, how will you proceed then? What we can do is, what we do is, after choosing the right remedy, then we have to choose the potency. How will you choose the potency? For example, if it is a case of pneumonia, that means an organ is affected. That is just the organ that is in the lungs. So in those cases, it is better to go with a medium remedy or low potency. That is, even we can go ahead with 30 potency. For example, if the patient is having very intense heat, sudden fever, and it is a child, then in those conditions, it is an acute illness, suddenness, all those things need a, a, a high potency, that is 1 potency. That works. For example, if that is a typical picture of belladonna, and that's how the belladonna act in those conditions. So if you are clear that this is a pulsar patient, or it is a rustros patient, or it is a classical belladonna patient, then you can go give the right remedy in high potency. That's about. That's how these are the things what I used to do in my clinic. And what I get this kind of result after choosing this kind of selection method. So that's why whenever you want to repeat the remedy frequently, or if you want to repeat in those conditions, what you can do is you can just sit on to the LM potencies. That is, for example, if a person having a peptic ulcer and you get the remedy like a podium-assist constitutional remedy or the right remedy for the time being, then you can sometimes you need to repeat that remedy. In those conditions, you can take this lycopodium 0/3 or 0/6 or whatever may be. The LM potency works in wonderfully in those conditions. So thereafter, once the patient gets relief, you can gradually withdraw the medicine and naturally he will be free of the disease. But in the early part of my career, I used to give 30 potency, 200 potency, 1 potency in an order in peptic ulcer-like conditions. But in those conditions, there was a problem. Whether I should go in those times when I was not having so much of experience, I have a confusion whether I should go with the 30 potency again and again, or whether I should go to the next potency. Everyone can achieve this kind of experience through using all our tools in different times in different situations. So this is what I would like to add to that potency selection. And then what we can do is homeopathy and homeopathic science is we say that we used to say that homeopathy is a science. How it become a science? That is the question. It's just only philosophy. No, homeopathy has a basis of philosophy that support the science. That what are the two? What are the there are 4 things for a table. That is for the first 4 legs for a table. The first leg is law of what is the knowledge of disease, knowledge of then first is the knowledge of laws that is there in homeopathy. Second is knowledge of the disease. Third is knowledge of the pathology. That is what is there you see in a disease. Then what is that? The fourth is the application of these things together is the uh, that is a law of cure that we can say, whether it is cure or suppression. Like all these 4 things constitute what we call as the science of homeopathy. And why then? Then we used to say that homeopathy has a part of this thing called art. What is the art of homeopathy? This is the question some people ask. Oh, you people say that homeopathy is an art and homeopathy is science. Then how will you differentiate these things? Yes, really, homeopathic science, when you apply this knowledge for the purpose of cure, that is the science of homeopathy. Then what is the art? When you apply these things for the purpose of cure, that is what I told that when you apply these science for the betterment of a patient, this is the art of homeopathy. That is the art of homeopathy. Then who is the best homeopath? People used to say that, oh, I am having MD, PhD, I am the best person, I am a rank holder. No, it doesn't matter that you are a best practitioner. This is what Dr. Kent has written his philosophy, that if a person still having very first rank or second rank, but is struggling to get a patient cured, why? The person who loves homeopathy for the love of homeopathy is the person, the most successful person. And that is why some people, he may be drop out in the class first year, second year, and third year. But when he come to practice, he may be the number one, and then the first person who got the first rank. So the application of this science in a different method because we all know that how a picture of Gandhiji can be drawn, the artist need much painting or something. Just like within a fraction of a second, he can draw the picture of Gandhiji. So this is what the homeopathy philosophy is all about. And some people say that, oh, you people are quacks. Then who is the real quack? A person who really does not know how to use homeopathic tools and simply giving patents and all those things can be called as a quack according to our philosophy. But the real homeopath really give homeopathic medicine in accordance with our laws and principles, as well as you can use even in advanced pathology, you can use several medicine at a time. For example, that's why even in a case of polycystic ovary, you can give ovary 3x, the constitution medicine, either net remover or pulsatilla or sepia, whatever may be the medicine that is as a constitution remedy. Then, of course, you can give either sometimes you may have to give some tinctures, but all these three things are applicable when it is an advanced pathologically, it is a pathologically advanced case. But in not all chronic cases, it is a chronic case, it is entirely different. So we have acute diseases, chronic diseases, as well as advanced, pathologically advanced cases. The attitude of the doctor should be changed accordance with the circumstances, rather than simply going ahead with the giving some medicine here and there. Sometimes you may have to give the medicine and wait. You are waiting and waiting. If your selection of the remedy is wrong, it won't work. So that is also a dilemma for people. Used to say, "Doctor, I took the case in details and I found that the present symptoms are really right one, and but still my patient is not relieved." Why? Sometimes you may miss the biggest point. For example, the patient is telling some symptoms in accordance with his knowledge, but at times he may not be able to remember what happened. For example, very recently I have a case of a patient who was having recurrent epilepsy, and was treated by many people, and particularly and many as well as homeopathy doctors also. She was taking some. She's a nurse working in medical college, and when they came, so I thought that it is better not to go for any further details of her case. Simply, I just asked her. It was a busy time also, so I just simply asked, "Oh, do you remember when it happened for the first time?" Then this lady simply waited, and then husband started, "Oh, yes, doctor, we were not aware about all those things, but one in the early part of some months back, I asked her mother, my mother-in-law, whether she had any such problem. Yes, doctor, there was a tragedy behind the illness." Then I asked, "What was the tragedy?" "Yes, doctor, you may be remembering some 30 years back, some 20 years back, an elephant killed a, a girl by hitting it on the back and head. And that girl was her close friend. She was there with the girl, and and soon after that, she developed all these shock symptoms." So what I did was that is the relevance or the importance of the causation. That is so what was the cause behind the illness? That finding out the cause behind the illness is the most important aspect, important thing as far as a homeopathy is concerned. And you will have to find the reason behind and in that condition, the incident, that is the biggest shock in her life. That was a sudden shock. And that was the reason why she developed all those symptoms. Then I simply asked, why this is there any problem with her within the short range of time? Is there any other exciting cause? Yes, doctor, last month her mother died. That also, soon after that, again the same thing. So these two factors will lead to the cause. Is the remedy. That is choosing the right remedy. That is the right remedy, I must say. That is Ignitia. I just give her Ignitia 10 and waited. And all of a sudden, that it really works in her state. And the husband on the very next day called me, doctor, it is really a wonderful remedy. She felt after for 1 or 2 3 hours, she may be having some, she has some little bit of problem. But later she took she went up to in a big sleep, and there was she wake up only 7 a.m. in the morning. So that was of relief that remedy has given to her, and she it was thereafter she feel better. And still she is continuing my treatment. She is quite okay, and that's what we must say about the beauty of, that is what the power of homeopathy, and this is how homeopathy works in those conditions. Whether it may be a chronic condition, or it doesn't matter whether it is a chronic or acute. It is the real exasperation of the chronic disease itself. She was taking some allopathic medicine. I didn't then ask them to can discontinue to cut size the number of medicine, and soon after that they reduce the medicine. Now she is taking only homeopathic medicine, but there was a slight uh, aggravation of epileptic episode, but soon after, then I repeat the medicine once again, and then now she's quite okay. So not only that, she gained some 2 kilos of weight within the treatment. So that means that is the beauty of homeopathy. That this is the relevance or importance of the causation of our medicine. Why? No, causation of our medicine, not the causation of the medicine. The importance of causation in choosing the right remedy. That also will work. So these are the things that one need to study, and this is how homeopathy can move forward. So there are also, we have different situations. I still remember. So also some 3 months back, I have another case of abdominal pain for a patient who was having severe abdominal pain. Every now and then it is coming and going. And when I inquired about the doctor, everything has happened during some 15 years back. There was a traffic uh, collision. There is a big accident that took place with him. Fortunately, he survived, and his brain was totally damaged and was admitted in a hospital and undertook some 3 surgeries. And thereafter, it took a lot of time to recover. And was thereafter, he is having only very few, little vision. So after that, he is suffering this kind of pain. He has consulted so many doctors, and there several times we took X-rays as well as USG, then MRI, all these things. But still, the patient is suffering, and he's unable to eat anything. And these are the conditions. But in those conditions also, we can think in the same way as what I told. What I did was I just give arnica first for some uh, 3 to 5 days, but not much improvement. But after that, then I just went up to the same problem. This is really he was over expressing. He's so talking. He's very much the typical remedy I given was Hyoscyamus Bonum. It really works him. So in those conditions, it was not a remedy directly chosen for this acidity, hyperacidity, or peptic ulcer, or even simply indigestion. But nowadays, he never felt bad after taking that medicine. They are very happy because They never thought that this kind of change can happen within a week. That is what I have noted in that case. Anyway, anyway, these are the circumstances where a homeopathic doctor may think in other ways. You may think that, oh, it is a case of person who is taking so much of medicine, you can just go with the Naxomica. But you know that if the patient is an Naxomica patient, he definitely will be an attacking personality. Oh, doctor, I don't like your medicine. I'm taking this much of medicine. How it works, doctor? I have so I'm not so that kind of attitude will be there. So if the patient is in a different way, his talks are in a different way. This is very important for us to choose the remedy according with the symptoms. Uh, so not only I have seen several cases, even in infertility cases also, we will have to sit with the patient and we will have to talk to the patient and we will have to see what the patient is telling and why. When I have seen that there are cases that come to our clinic and they ever have intercourse even in staying together for 1 to 3 years. But nobody knows about that. They never reveal to their persons also. When they are going out, they may be showing that they are very lovely and they are happy, but there are obstacles that you have to find out. For example, a kind of a case, a patient was brought to my clinic with her husband. They are very married for 1 year, 1 hour. They were married together for 1 year. They're living together, but they never have intercourse in their life. So in those conditions, I asked why this is happening. Yes, doctor, there is a story. It's a very difficult thing for her to tolerate all this thing. Then I asked about how was your first night? Oh, doctor, it was terrible. What happened? Oh, doctor, when I tried to have it after having a lot of chat with her, then I tried for this course. She suddenly told me that no, I cannot do all these things. So what happened was I just fainted. The male person, the husband really fainted, and he was taken to hospital for medication, and he was given some IV drips and everything. But nobody thought that it is due to this shock he happened. He has suffered due to this unexpected happening from the wife. But they stayed together and nobody knows about these things. But while she had a visit to her family, one of her friend is a little bit elder than her. She asked why this is happening. Then she told that it is very difficult for me to have this intercourse with this boy because I am having severe pain. Then that lady directed her to me. And when she reached my clinic, then I asked her, "Oh, do you have any fear of this?" Yes, doctor. In the previous, before marriage, one of our eldest cousin told that it's a very painful thing. So thereafter, I couldn't tolerate these things. So that may be the reason. Uh, so in those conditions, we have to give the right remedy. We have to choose the right remedy and give some consolation. Then I ask them to just try again and again. It's quite normal that most people are having a little bit of pain, but it does not mean that you are having severe pain. So what I just Netramo was given in the beginning, and as you all know that Netramo really enjoyed the sex. That also because, but here is she had a history of love failure also. But after giving that, she was a little bit shows a little bit of improvement. But later I gave platina. and that works wonderfully. And now they have a child who is having 3 years. So this is how a homeopathic doctor need to interact with the patient, and you just need to choose the remedy accordingly. Never think that, oh, this Natromol will give you the result. But of course, that can do a lot of changes in the body. But of course, sometimes if you give another correct remedy, that will work very brilliantly. And this is what I would like to say at this juncture. This is so, I think our guest has not joined, and because of that, I have to explain some, I have to have a discussion. I invite some of you to participate in the discussion. We can go ahead with the discussion here. And those who want to participate in the discussion can raise your hand also. So I invited Dr. Kalyan Swarup to go ahead with the discussion, to join me in the discussion. Please unmute, sir. We can say a lot of stories, but...
I am audible?
Yes, sir. Yes, sir.
Sir, your lecture is very fine. According to the philosophy of homeopathy, you're going to the right side. One thing I want to say to you, when you are going to treat any chronic disease, after the case taking, you must try to select the vegetable group of medicine.
Yes.
First, try to prescribe the vegetable group of medicine. But lycopodium is also a vegetable group of medicine. But never prescribe lycopodium first of all. If you are 100% confirmed the patient is suffering from the lycopodium patient, then you can give. Either where there is any kind of suspicious, you cannot prescribe lycopodium to the patient. Second thing, you are telling about the potency. Doctor can't say that first you try the medium potency with the patient. And medium potency in chronic disease is about the 200 potency. So first you start from the 200 potency and you see your medicine going to work up till your medicine is going to work. Never repeat the same medicine or the same potency. You wait and watch for the patient. And you see, when your medicine is not acting, then you can prescribe the same medicine, same potency, 2 or 3 doses, and wait for a week or see if the action is a start from that potency. Never prescribe the ever potency from the 200. If your 200 is not working at that time you never change your medicine, only change the potency of the medicine, and you give the higher potency, 1 potency. This is the principle of the homeopathic science. Actually, the selection is potency is not a easy problem. Very, very big problem for the homeopathic science. My teacher was Dr. P.C. Pal, who says that potency problem is the major problem. If a driver is driving the car or owner is sitting on the back side, owner is saying you go to the right side, left side, right side, left side. Driver must be accident anywhere because driver don't know where I will go. Right side jao or wrong side jao. So must be a homeopathic physician must be a study about the potency. Or potency is the, Kant says, it is the complete depend upon the experience and observation of the physician. This is not a law. There is no law. There is only the experience and observation of the physician. If the physician is complete, have a better knowledge of observation, complete observation means you always open the 5 senses of your organ. Then you can perceive the patient. And your perceived patient means you observe the patient. Or when you observe the patient, your selection will be right. So right selection is the matter of the experience and observation also. Right potency selection also depend upon the experience and the observation. And this experience come from the better knowledge of your materia medica, better knowledge of the organon of medicine. If you have no knowledge of the materia medica, you can suspect your selection of the remedies. Suppose, for example, I am saying that if a patient suffering from the coryza, your case is going towards the thuja patient. You are 100% going to selection like the patient is like the thuja symptoms. You ask the symptoms, which side of the nose flow your right side or left side? If the patient say, my nose is flow mostly from the right side, a patient is going towards the thuja patient. You think your patient is misguided to you. Patient is not saying the right thing. If the patient must be the thuja, his nose is running of the left side, not the right side. So this knowledge comes from you by the help of the materia medica. So better knowledge of materia medica help to selection of the remedy, better knowledge of the organon, yourself the miasmatic ground of the patient. You must be treat the anti-miasmatic treatment. Without anti-miasmatic treatment, you cannot cure a single chronic case. The homeopath must know about the miasm for the final touch of the chronic case, or must give the anti-miasmatic drug. When I give the anti-miasmatic drug, then the patient cure and restoration of the health. The restoration of health comes from the anti-miasmatic treatment or the proper selection of the medicine, and proper potency depend upon the experience and the observation. This is my thinking of Cesar.
Yes, exactly. This is what I was mentioning here. You just added some more points here. That's very, very good indeed. Indeed. And for example, as you know that if once I just want to mention about a patient that's very old, and when I was taken to that bedside of the patient at his home, what I noted that the patient was lying on right side. But all those things I noted only on the right uh, on the last part. But after thinking, reaching there, then I asked them to ask them to allow the patient to lie on the left side. Then so they suddenly told me that, oh, doctor, it is not possible. He never lies in that way. So that was the correct indication. That was the real indication of phosphorus for me, because all the other symptoms were corresponding. But I was in a dilemma whether I should go with some other remedy or that. But because that was a sinking condition, but for that phosphorus, choosing the right remedy at the right time, that is through my observation, I found that phosphorus is the remedy for that patient. I just gave him phosphorus 30, and that works wonderfully. And the patient lived for some 2 to 3 years more, and in a better way. That's what I would like to add to that session. That this is what the importance of observation, as well as collecting your knowledge after some people. This is what we have to do is when you repertorize a case and you get the right remedy, get a remedy, then you will have to make sure that it is the right remedy. What you have to do is just read the materia medica, what it is written in the materia medica. For example, when I was a beginner in the part, once I was asked to visit a patient who was having severe vertigo, and when I reached there, what I found that she was sitting. Then I thought that it is due to the respect, for example, or maybe for examining the patient. That is the reason why she. Then then after inspecting, they told me that we can have a little bit of lime juice. Then I was waiting for that lime juice. Then I noted that she is not lying down again. Then I asked, why you are sitting? Mom, you can lie down. No problem. You are in sickness, vertigo. You may lie down. No, no, doctor, I can't lie down. I can't lie down. Well, that is the remedy. That was the calling for the remedy. Then in those days, I was not much familiar with materia medica. So then I went to the clinic and then I searched the remedy for that. Then I found that it is conium. Then I took the book conium. First I took in those days it was repertory kind of book repertory, not no other laptop or anything. Only that books were used, and then it was written that conium. Then I took the materia medica and then searched what is this written for conium. Yes, it was the rare, peculiar, and uncommon symptom as far as the conium is concerned. So I took conium 30. I just gave her conium 30. Thereafter, she lived for some 25 years more, and she died at her one completing century, that is 1,101 years. That means thereafter she never took any allopathic remedy. Even I was asked to confirm her death at that time. That is how homeopathy works. And this is what the importance of observation. So in those days, I have no much knowledge in materia medica or anything, but simply I use logical thinking. That is the need. I invite Dr. Manoj to add some point of to this session, because our guest has not joined, but just what I did was we just have a very good discussion. I think I'm not sure whether it was a very good discussion or not. I just
Definitely. Things will grow brighter as minds are brought together and melting harmoniously. The more we keep together, the better. The more we think on us, the better. And I think the study on Ken's materia medica is the most valuable one as in such situations. Definitely, that will give you more clue regarding the patient. When we go to the boric material, we will not get such an idea. But if you go through the Ken's material, definitely. Then again, you mentioned about the vertigo case. There's a general symptom of Belladonna and Thuja. Anything out of perpendicular will aggravate the complaints. In case of Belladonna and Thuja, I am still remembering. I think Dr. Shafiq was also there when I was an intern in Trivandrum. There was a patient suffering from severe headache. She cannot lie down. At that time, at night, she was sitting there. Everybody's begin to sleep. When we asked what happened, then she said he cannot lie down. I suddenly remember that line. I think it is written on the rabies materia medica by T.F. Rabi. I think there's a material medica there. It was around 30 years back, and given Belladonna, it was suddenly recovered, rather cured, not recovered, cured. So that type of cases are there, and if you read such materia medica with some passion, as well as we must, before studying the materia medica, we must study the topic of symptomatology on tuberculosis. Otherwise, we will be in a total confusion, which almost all medicines has got very similar symptoms. Which one is important? So the characteristic symptoms, the important symptoms are written there. That's the most important thing. But unfortunately, the Ken's materia medica as well as Dunham's materia medica, these are not at all studied in our institutions. Kalyan Swarup, sir, what is your opinion?
Yes, sir. Yes, sir. Sir, you right, sir. One thing I want to say you, sir, we must know about the symptoms of the materia medica. By these symptoms, we prescribe the medicine. But we must know the contraindication of the medicine also.
Yes.
Just like the chamomilla. Suppose you have seen the chamomilla.
Yes.
The chamomilla is when all symptoms is with patient. All symptoms you found the chamomilla. But the patient is very mild nature, calm and quiet nature. Never give chamomilla to those patients.
Yes.
Suppose that in the case of arnica, where there is injury of the arnica, you are in every injury case you prescribe the arnica. But where there is no soreness, never prescribe arnica.
Exactly.
So must we know the contraindication of the symptoms. Suppose you are going to prescribe the belladonna. All the symptoms met with the belladonna, but patient is very cheerful nature, very cheerful. Never give belladonna to the patient. So we homeopath must be try to know the contraindication symptoms of the medicine, and that will damage to the patient if you prescribe that time, sir.
Yes. Definitely, in such cases, the acute conditions will open up
Yes.
the case.
Yeah.
And this is mentioned in our organ of medicine. There is a footnote where Hanima indicates about this contraindication. Chamomilla. Nexom, I think Nexomic and Ignatia is mentioned there in the footnote. I not remember the exact number of the footnote, but it was there. With mental calmness, content, just like that, the Ignatia. If the patient is constantly vexed, it is indicated, but otherwise it will not indicate. So that is why Ken often refers that acute cases often offers you a golden opportunity to identify the patient. That's most important. Moreover, total professionalism is needed when you're studying mathematics because there's a big wider subject. We cannot reach to at least 10%. The tip of iceberg is there, but that is a situation mathematics, I think so.
Yes, we need to.
One thing I want to also say to you, sir.
Yeah.
One thing also want to say, a homeopathic doctor must be competent knowledge of the practice of medicine also.
Definitely.
You see, every converted homeopath which come from that allopath to homeopath, they are better prescriber than the real homeopath.
Definitely.
Because they have knowledge of the practice of medicine. If we have knowledge of the practice of medicine, we can evaluate the common symptoms of the medicine.
Yes.
Because on the common symptoms of medicine, we never prescribe the medicine. We prescribe on the uncommon peculiar symptom, characteristic symptom, red line symptoms, and totality of the symptoms. We are never, only common symptoms help to us for the diagnosis of the disease, not for the selection of the remedy. So if a homeopath doctor have the better knowledge of practice of medicine, he will be the good prescriber, he will have the better knowledge, and maybe the chance of good take name and fame in the field.
So I think more than that, the education method is totally different. Our brain is often underutilized. But what happens in the MBBS course, they are really working hard and hard. That is another thing, very different type of education. That is also a very important thing, I think.
Yes, that's the reason why in the beginning itself I told that the thing we need to look into is that whether we have to take the symptoms of the disease or the symptoms of the patient. We just need to eliminate the symptoms of the disease from the total symptoms. Then that is the individuality of the patient. Then that's how that is why we used to say that you have to eliminate all these things when you choose the when you go ahead for a repertorization. That's why I concluded the session in that way, that it is homeopathy is nothing but mathematics.
Yes, that is also mentioned by our master.
But unfortunately,
Yes.
there are people who are coming down here and saying that homeopathy is medicine, is my philosophy, but it is not so. We can.
Then only it becomes the mother of all sciences like mathematics, as mentioned by Hahnemann. That is also there in the footnote. Everything is written there. No, nothing is left. The Dr. Lata Marahan raised the hand. Dr. Lata.
Yes, doctor.
Sorry, sir. Sorry, sir. I am not able to discuss with you.
Okay.
Accidentally, it is
Right,
touched. Okay.
No problem.
Okay.
No,
Sorry.
Yes.
Okay.
Well, as mentioned by Stuart Close, there are no accidents in nature. That is also an important thing. That is why we homeopathy physicians always considering each and every minute points. It's also logical. Just like the tailoring of the case. Yes, Dr. Dhanesh.
Yes, exactly. That's also a very good thing. Now I invite Dr. Ram Parisa to say a few more things to our session.
Thank you, Dr. Dhanesh ji and Dr. Kalyan Swarup ji, Dr. Manoj sir. Very, very thanks. Today the guest not joined discussion. Uh, very nice, very beautiful discussion. Dr. Kalyan Swarup is the uh, acute case, या contraindication case, acute symptom, the angle of treatment, acute angle, symptomological treatment, contraindication treatment, and temperament, body language, and chronic treatment. Chronic treatment is the role of miasmatic. Important role of miasmatic, SORA, psychotic, and syphilitic. Without miasmatic treatment, chronic disease not cure the symptom. So very, very thanks, Dr. Kalyan Swarup ji. Thank you, very, very thanks. Thank you, sir.
Yes, anyway, we were able to go ahead with some discussion on the subject also. And we all know that at the time of COVID, people used to say that we are the people who are supposed to treat this COVID. Those people are having no medicine at all. But homeopathy, why we used to say that we have a remedy in all kind of diseases? Because we never give the first importance to the diagnosis or the disease itself. We need the man in disease rather than the disease first.
Actually,
That is why we used to say that we have a remedy for COVID. Whatever be the symptom, in the early part itself, we were able to choose the right remedy, and we were able to when COVID reached our home, that is our home places, we were able to treat them without any trouble. We were able to conquer the COVID disease in a very good way. There are doctors in Kerala who are having 5,000, 3,000, 10,000 cases of cured cases of COVID. Because not even a single casualty happened with the homeopathic treatment. That also is a very good thing. This is what we used to say to the public, that we have a remedy. A lot of videos were prepared by homeopathic doctors and published among different group, and that really resulted in a good propagation of homeopathy during the time of COVID. And people thought that homeopathy hospitals and dispensaries and clinics will be shut down due to COVID, but it is really, COVID is a big boost for homeopathy, I must say. What's your opinion on that, Dr. Kalyan Swarup?
yes, sir. Yes, sir. You are telling very right thing, sir. No doubt. You are very okay, sir. You are right, sir. Due to the lack of knowledge your lack of knowledge is a very bad thing for the homeopathic science. You must have the better knowledge. Then you can settle in your field. You must be settled in your field with the better knowledge. Little knowledge is dangerous.
Yes, definitely. That's the reason why we started this Zoom sessions, and we have to see how we can work together from doctors from different part of the world, sitting together and discussing about the diseases and how we can manage the cases and how we can move forward in chronic treatment of this acute illness like this. That's the reason why we have a discussion on Chandipura virus, the latest problem the people in Gujarat suffers. And now here we have another, in Kerala, people used to say that this disease is coming, Nipah is here, the other, maybe encephalitis is here. But as far as we are concerned, we are not bothered about the name of the disease. We can definitely go ahead with our symptomatology prescription. If we get a chance to treat, definitely we can treat the patient and win the heart of the patient, and will be a winner at the disease. The all in all, we can win the case, and we can give tribute to homeopathy in that way also. I invite Dr. Ram Paresh sir to say a vote of thanks to the session, as we have to finish the session within 1 minute.
Thank you. Very nice. Excellent session. Today is excellent session. Dr. Kalyan Swarup and Manoj ji and Dhanesh ji and many people joined. Very nice. Behalf of IFPH, Dr. Kalyan Swarup and Dr. Dhanesh ji, very, very thanks. And again, presentation, and every day join in English session. Kindly, Dr. Kalyan Swarup is the present. Very nice. Thank you.
Thank you, Dr. Ram Paresh sir, and those Dr. Kalyan Swarup, and those who participate in the session. Tomorrow we will have a session from Dr. Shashi Mohan Sharma. Sir will be discussing about some of his very, very important cases tomorrow at the same time. Hope all of you will be back with us tomorrow, which will join us tomorrow at the same time. Good night. Thank you all.
Good night. Bah, bah.
Over to Dr. Manoj to moderate the Malayalam session.